depending on whether or not Medicaid still exists, which is only half a joke. So yeah, I'm just going to kind of start it off with a quick quiz, because I think part of my job in talking about Medicaid and what we need to do to protect Medicaid is making sure people really understand what the program does for us in this country. So, first question. If you are poor enough, you can get, and I shouldn't say poor, sorry. If you are low income enough, you can get Medicaid in Florida. Is that a correct answer? No. Why?
Because Florida doesn't support it.
Exactly. You have to be categorically eligible in Florida. So you can be extraordinarily low income, and unless you fall into a particular category, which I'll go over in some more detail in just a second after I ask my other questions, then you will not be eligible for Medicaid in Florida. We are one of 11 holdout states who has failed to expand Medicaid at this point. And that's, a disappointing side effect of what's going on right now is there's a lot of discussion about eliminating what is currently 100% match for states who choose to expand Medicaid. So Medicaid, of course, is a federal state share program. The federal government matches a significant portion of the state dollars that are paid in each program. If states were to expand Medicaid right now, they get 100% match for that particular population, the cost. So the federal government's bearing all the cost, essentially. And if we have the Medicaid cuts, there is significant discussion about eliminating that match. So it wouldn't currently affect Florida with present Medicaid expansion, but it certainly curtails our ability to advocate for that expansion. So if you have a very significant disability, let's say you have paralysis and you're unable to ambulate, no matter the income, can you qualify for Medicaid? I saw you shake your head. No, you can't. It is income determinative. And in fact, for disability-related Medicaid, it's not only income, not only is there an income test, but there's an asset test as well. This is a good one. People who are undocumented can receive Medicaid. Is that accurate? No, it's not. We have very significant restrictions on what immigrant statuses qualify for Medicaid. For children ages 0 to 18, those restrictions are slightly less significant, but still, even in that population, you have to have what they call a lawfully residing status in order to qualify for Medicaid in the state of Florida, in most places. Okay, so that's kind of getting at my first topic of the night, which is who does Medicaid cover? And coming back to categories of eligibility, in Florida, we cover what I like to break into, what the state breaks into two major umbrella groups: family-related Medicaid and SSI-related Medicaid.
And what?
SSI-related is what the state calls it. But essentially, SSI-related Medicaid is people who are age 65 and over, as well as those who have significant disabilities. So it's not someone with, say, diabetes or heart disease, or things that limit their ability to work that certainly make it important to asthma, certainly make it important to have access to healthcare insurance. That is not going to rise to the level of disability as defined by the Social Security Administration for purposes of qualifying for Medicaid. You have to have a significant disability. You have to be unable, the term is, to engage in substantial gainful activity. So essentially, you have to prove that you can't work typically 40 hours a week because of your disability, which is, it's a very high standard. We have something like a 60% denial rate of disability just in the Jacksonville area. Yes, you have to renew annually, absolutely. So under that family-related Medicaid category, and actually staying on SSI-related, as I said, every category is tied to a certain income limit. So for SSI-related Medicaid, it's the same income limit as it is for supplemental security income. which is roughly no more than $934 a month and no more than $2,000 in assets for an individual. So we're talking about very low income, very, very low income. And then the family-related Medicaid category, that's going to be children ages 0 to 18, adults 20 to 21 who are still classified as children, which is why they fall into a category, but the income limit between children 0 to 18 and then 20 to 19 and 20 drops significantly. So 138% of the federal poverty limit if you're 0 to 18. At 20 years old, it drops down to 38% of the federal poverty limit. So pretty much no one qualifies at that point. I was spinning out the math, but I was talking with a reporter today who's doing some really interesting work on Hope, Florida. Pay attention to that. But I was spinning out the math for her, and for a family of 4, in order to qualify under that 38% FPL, I think it was something like the household couldn't make more than $650 a month.
Oh,
Thanks to the Affordable Care Act, however, the family-related Medicaid categories, which federally is called MAGI, thanks to the Affordable Care Act, they eliminated the asset test. So families can pay a little into their 401ks, they can have 2 cars, they can try to develop a little bit of a nest egg while they keep access to health coverage for their children. And then parents and caretakers fall into that same income limit as 19 and 20-year-olds. So you can qualify for Medicaid as a parent in Florida, but you better not make more than $600 a month as a household of 4. And then for pregnancy Medicaid, women, people who are pregnant, and luckily just a couple years ago we expanded 12 months postpartum, so pregnancy plus 12 months regardless of the change in circumstances. That's 200% of the federal poverty limit, so a bit higher. And that's probably why, I know I wrote it down somewhere. I think that's right. Half of pregnancies in the US are covered by Medicaid. Oh wait, I see what I did. I have half of US children. That's not accurate. It's half of people giving birth or use Medicaid, and then in Florida, I'm sorry, I wanted to have these numbers at hand for you. I will pull out I swear it was 17 million. 17 million disabled people with disabilities are covered in the US. I just mixed up my numbers for children in pregnancy, I apologize. So that's who it covers. And let's dig a little deeper into that too, because there's a lot of conversation now in the Hope Florida world, but also I'm going to touch on work requirements a bit later about how people are staying on the system too long, or being given the right resources will be able to come off Medicaid. If you really examine this in a state like Florida, which is a non-expansion state in particular, it just doesn't make sense. So for example, people with disabilities, no matter how much money they earn, they're always going to need to have Medicaid. And that's because Medicaid, as compared to private health insurances, covers much more expansive benefits, particularly home health services. So a person who is an adult and wants to work but has a significant disability, needs help getting out of bed in the morning, uses a wheelchair to ambulate, needs communication devices to communicate, but is a professional in every way and wants to participate meaningfully in work and everyday life, they have to have Medicaid. There is no other kind of health insurance that will support their needs. So if we're talking about cutting Medicaid, we're talking about taking people's livelihoods away from them simply because they have disabilities. Any questions on who Medicaid covers before I move off that?
You didn't mention end-stage renal disease for...
That's Medicare. Yeah, ERSD is a special Medicare program for people who are diagnosed with end-stage renal disease. Yeah. But we will be, I think, looking at cuts to Medicare as well. So certainly relevant relevant to the discussion.
What about nursing home?
Yes, so I was gonna move to what services, get more in depth in what services Medicaid covers. But that is typically the population that Medicaid covers specifically in Florida.
And I was just gonna say the association between the expansion states with medical poverty, you know, or causing such extreme financial burden, the states that have not.
Absolutely. Digging into, and I don't have these stats off the top of my head, but digging into medical debt, I mean, there's a big reason why the CFPB eliminated medical debt from credit reporting, and that's because it's the #1 incurrence of debt in this country. I mean, GoFundMe had a fascinating article from its founder that said that they had no appreciation for the fact that very quickly they would simply turn into a fundraising entity to pay off people's medical debt. Yeah. So yes, absolutely. Also, let's talk about preventative healthcare, right? I mean, if people, not having Medicaid expansion costs us because our tax dollars go into uncompensated care, which is far more expensive in all of the ways than preventative care is. So financially, it's a bad decision. And then I just want to circle back around to the point about the standard by which you have to establish a disability to qualify for Medicaid in a non-expansion state. I mean, if you're dealing with diabetes, right, severe diabetes, you need insulin. But in Florida, if you can't afford private health insurance or marketplace, and you don't fall into one of these categories, you have to hope that you can access insulin through charity care. I mean, it's just so disturbing. And at the Medical Legal Partnership, I spent a lot of time, we partnered with Jacksonville Health and Transition Services, which is an amazing clinic out of UF Health that helps people who are medically complex transition from the pediatric system into the adult care system. And I spent a significant portion of time with JACSAT's patients, talking to them about how their Medicaid was gonna end and there were no other options. I would counsel them to move to other states.
Wow.
It was awful. Okay, it's not gonna be a light-hearted conversation. I appreciate the outlet you all are giving me. So,
Misery loves company.
exactly, especially right now. So what does Medicaid cover? To Carol's point, it covers the vast majority of long-term care in this country. Oh, I have pop quiz questions, wait.
Totally forgot.
So if you have a child who's on Medicaid, no. Yes, sorry. If you have a child who's on Medicaid, but they have primary insurance as well, does the primary insurance have to cover their in-home nursing if they have, say, like a tracheostomy and are on a ventilator? Does private insurance have to cover that?
No.
No. And it does not. So you have to be on Medicaid. Or there's what we like to say is it stands on the shoulders of Medicaid. There's something called the Children's Health Insurance Program. In Florida, we call it Kid Care. So Kid Care will cover very similar benefits to Medicaid, and you can access in-home health services with copays and a premium. But your private insurance will not cover that. If you save enough money throughout your life, you can afford a nursing facility if needed. No. Again, Medicaid pays the vast majority of long-term care in the country. And I answered this question for you guys, but let's see if you're listening. When you can't ambulate, get in and out of your bed, transfer independently, private insurance will cover the personal care assistant that you need. Need Medicaid. So, again, it covers services that enable people with disabilities to be able to function and live meaningfully in our community. Without Medicaid, that doesn't happen. And it's one reason why me and so many Medicaid advocates, a program that's particularly near and dear to our hearts. I started out as a disability rights advocate, but there is no disability rights without Medicaid. home health services, a really cool benefit that I'm sure Carol knows all about called Early Periodic Screening, Diagnostic, and Treatment, or EPSDT. It's a special benefit for children under 21 that says, so the way Medicaid is designed is the federal government gives the state a floor in terms of benefits they have to cover, and then it gives the state an option about like a menu that the state can pick from to design its own Medicaid program. So what EPSDT does is it says, for those optional benefits, if the kid is under 21, you have to provide those benefits. We don't care if you don't want to provide them for adults, you have to provide them for kids. So Medicaid is an extraordinary health insurance program for children. And I have been able to move mountains for clients with EPSDT. A great example is, well, I'll give you a couple client examples. One was referred to me from Nemours Children's Specialty Clinics, 15-year-old with a eating disorder and other mental health conditions. And she was in managed care. Does anybody know what managed care is? Okay. So managed care is Medicaid that is administered, our Medicaid program, Florida's Medicaid program, is administered by private health insurance companies the state contracts with. The managed care plan told little girl's mom, we can give you a psychologist, but they go to the psychologist has no knowledge about eating disorders, no specialties. So we approach the state and we say, all right, well, the plan's got to go find a psychologist who has specialization in eating disorders because EPSDT says so. And they found her one.
Wow.
Private psychologist, the plan had to, contract out of network, but got to do it. And then another child client of mine who had a wound that kept opening up, kept going to the hospital because the wound would open up because he needed wound care in the home. And there just really aren't a lot of wound care providers contracted with Medicaid. So we filed a complaint with the state and we said, you have to cover it, go find them. And they had to not only cover it, they have to arrange for it. So they have to go find the provider and bring the provider to the child. It's a very powerful benefit. I love it. And related to that, Medicaid covers a significant portion of the services that children are receiving in the juvenile justice system and the juvenile justice system and the dependency system. And that includes, these are kids who have very serious, significant mental health concerns. And it is Medicaid who covers those services. Inpatient, community behavioral health, wraparound services, medication management, case management, that is all Medicaid. Those kids are getting those services because of Medicaid. Not after 21. That's right. After 21,
You're on your own.
yeah. There's still, we'll talk about that with block granting a little bit though. I'm never gonna throw Medicaid totally into it. And then, similarly, school-based health. So an interesting number I pulled from the National Health Law Program, they have an amazing website devoted to Medicaid defense. So tons of fact sheets, all the numbers I'm not able to rattle off the top of my head tonight. Go to InHealth's website, Medicaid Defense. They have every fact sheet you could possibly want to read. And we have some stuff on our website as well, Florida Health Justice Project. But $4.5 billion in Medicaid are spent per year on school health. Therapists, mental health counselors, just really, helps our public school students be able to better thrive. And if you're taking away Medicaid, you're taking away access to those services. So that was just kind of a synopsis of what Medicaid covers, why it's important. Does anybody have any questions about that? Okay. Yeah, and then I think, actually, I didn't talk about nursing facility services, which of course, I think, based on your reaction with my pop quiz question, the vast majority of nursing facility services are covered through Medicaid. You really can't access nursing facility services without Medicaid, which is why you have Medicaid planning attorneys, right, who help you figure out income trusts and special needs trusts and qualified income trusts, that kind of thing, to manage your income and assets so that you can access long-term care. There is also long-term care or SNF diversion through long-term care waiver, which allows you to receive home and community-based services in your home, long-term care in your home. There are significant wait lists in Florida for those particular services, though. I think last time I looked for the long-term care waiver, which is really like the nursing home alternative, it was like 32,000 person long wait list. And the I-budget waiver, which serves people with developmental disabilities, I think it's like 52,000. And actually, just because you guys seem really engaged in the news, follow a little bit. The waiver for people with developmental disabilities, the agency that manages the eligibility is the Agency for Persons with Disabilities, and they've had a budget surplus for like 2 years and are failing to enroll people on the waiver. So really interesting stuff, yeah, at the state level. Surplus. They're suggesting, I mean, there's been a lot of subcommittee hearings on it. I think APD's response was they're worried that if they spend their surplus, they won't be able to catch up with the increase in cost of the services for those people who are already enrolled on the waiver. But it's like the numbers aren't matching up. No, surplus. And I mean, they've acted under a deficit for years and years and years. So a lot of families struggling out there. And the folks who would most benefit from the DD waiver would be parents who have medically fragile children, whose care needs aren't being met through private insurance. Because once a child is enrolled on a waiver, then only their income counts to determine their Medicaid eligibility, not their parents. So they can, essentially, what it enables parents to do is go and earn the wages that they have the potential to earn, but the child can still stay on Medicaid and receive the services they need to stay alive. So yeah, so it would really benefit those particular families, and it's too bad. Okay, so I'm just going to shift to talking just a little bit about the national landscape and what we're going to be fighting against. Did I have a question? Oh, I know. So the Florida Medicaid program is rife with fraud and abuse by recipients.
No.
Right. Do we have provider fraud and abuse?
Yes.
Do we? But we do not have rife abuse of people who are illegally enrolling in Medicaid. Block grants, do they give states more flexibility in terms of the administration of their Medicaid program? Yeah. I can talk more about block grants. I think this is kind of a trick question. They do, but the flip side can be very problematic, and I'll go into that a little further. But I think the reason I raise those questions is I think that's what you're gonna hear in defense of what we're going to see in terms of justifications for cutting Medicaid and in ways in which we should be cutting Medicaid. As soon as the House and the Senate are willing to admit that they're cutting Medicaid, we haven't even gotten that far. So with that, as Carol brought up this morning, and I will admit I'm a litigation attorney, so I have policy people at my organization. They've been following this much more closely than I have. In fact, I've tried to keep my head in the sand a little bit just because it makes me sit down. But I did call a policy person this morning and said, I'm going to this thing tonight, you have to catch me up. So as Carol said, the House voted today on a resolution that adopted, I think it was 1.5 trillion in cuts. That mirrored what the Senate had voted on, but the little tiff they had yesterday where they couldn't come to an agreement, it's because the Senate punted this huge cut to the House to decide what to be cut, which essentially was just telling the House, you're gonna take the fall for whatever gets cut. And the House was like, no, we're not doing that. So it's since, again, been voted on and passed, but not with a lot of specificity about, what those cuts entail. So this is the message that I have been told to deliver to you, which is the target is $880 billion to pay for the tax cuts that they're planning to enact. And with that target, there's no way that Medicaid is not on the chopping block. There's no way. So they can try to obfuscate and say, and Trump can tell us that he is not going to cut Social Security, Medicare, or Medicaid. It's just not possible. The math does not shake out. Yeah. Yeah. So these two people, unfortunately, are our targets. And I guess I'll start with the call to action, which is walking away with this better understanding of what the Medicaid program is, what it does, who it would hurt, particularly in the state of Florida if we cut it. We have to tell these two people this. And I was also told, don't be fatalistic, which she was probably talking directly to me. She said that the reason that they have hit, I don't know if you guys remember what happened in 2018, 2019, around the same time that we had the ACA and the BIGRA, and we have John McCain putting the thumbs down, right? So we have had this fight, but at that time they were much more transparent about what was going to happen to Medicaid and what their plans were. This time they aren't, but the belief is they have really dialed down the information they're providing about what they're going to do to cut Medicaid, because they don't want us to know that they're doing it, and that's because they don't want to be held responsible for it. And because they don't want to be held responsible for it, it means that when you talk to them and tell them, I will hold you responsible for this, they understand, and there's some hope that that will actually move the ball at the Senate level. So just call them and tell them that Medicaid is important and we have to protect it. And you will make sure that they pay for it. And not just you. I mean, obviously they know which way you're going to go. But I think the real concern is they're going to lose their voter base if cuts to Medicaid occur. So we just need to remind them of that. Okay, so a couple ways that Medicaid cuts might come into fruition when they finally admit that they're trying to cut it. There has been discussion at the federal level that they would implement work requirements as part of the Medicaid Act. So they would amend the Medicaid Act to require to put in work requirements. We have work requirements for the SNAP program and for temporary aid to needy families, which was traditionally welfare. There is significant data out there to show that work requirements do not work. And I will also say, right? I was gonna pull some numbers for you. In Georgia right now, they're doing an experimental project with the Medicaid expansion population to try to get people enrolled in a limited Medicaid expansion population, but work requirements are tied to it. So 98% of the individuals, a very small portion have opted into it because it's so onerous, but of that portion, 98% of individuals fail to satisfy the state's detailed reporting requirements. 98%. Because they're impossible. It's also important to remember that in 2023, data shows that 92% of adults covered by Medicaid were either working or unable to do so because they were sick or disabled, had caregiving responsibilities, or were attending school. So people on Medicaid are working. Work requirements don't make sense. Work requirements are incredibly expensive. So I just glanced over here at the fact sheet. Georgia's program it costs $26 million to implement, despite very minimal enrollment. In Florida, what's particularly concerning is because we're a non-expansion population, everybody would meet an exemption, right? So they might even try to tell you, well, Florida's fine because the people that are on Medicaid in Florida wouldn't be subject to work requirements anyway. But we have a cautionary tale that we can share back with them, which is in 2016, it used to be that, so the SNAP, as I said, the SNAP statute has work requirements as well, but the state can ask for a waiver of those work requirements, which Florida consistently did for years and years and years, until 2016 when the Florida legislature passed a law forbidding the state administrative arm from asking for waivers from FNS for SNAP work requirements. So in 2016, we see a statewide rollout of work requirements for SNAP. And that litigation that Carol mentioned earlier was the horrific implementation of the SNAP work requirements. Through our litigation, we were able to recapture something like 500,000 SNAP recipients who had been erroneously terminated from SNAP for failing to participate in work requirements even though they were exempt. So it's costly, and it cuts way too many eligible people off. It's just a horrible idea. It's also not going to save $880 million from the federal Medicaid budget. Another potential thing that we might see come down the pipeline is block granting. So block granting essentially gives states, the federal government gives the states a finite pot of money, but with fewer strings attached than something as, you know, the setup with the federal state match share, which is just an ongoing match, so the federal government can be more restrictive in terms of its regulations. So with the block grant, you kind of just give the state the pot of money and say, here's your main goal, make sure you meet your main goal. And we've actually, well, based on the 1996 welfare reform law, we did this with what was welfare. And what welfare advocates will tell you is that after 1996, no one qualified for cash assistance anymore. There was a big scandal, was it Mississippi, where the state was paying, who's the football player? Favre. To go around and speak about the importance of work and to inspire people, and he was being paid in TANF dollars, because that's how loose the requirements are in terms of block granting. So right now, I gave you an example earlier about my ability to, file a complaint with the state and say, hey, this kid needs special mental health therapy, and you have to give it to him. With a block grant, I don't get to do that. The state would laugh at me. Maybe give me a football player to talk to. So block granting is very dangerous because what it essentially does is it takes away the rights of Medicaid recipients to benefit from the program, and we're handing the keys over to a state who has not really done anything to show us that we can trust that they're going to implement a program in the best interests of the recipients. And it certainly takes away my ability to advocate for clients in any kind of meaningful way. I think the last thing I wanted to talk about, another thing I think we will hear, Doge redux, is that Medicaid is full of fraud, waste, and abuse. And so we're just cutting $880 billion for the fat, which I can't even say with a straight face. Not true. So I have some good information about Medicaid fraud. So really where fraud is ferreted out is improper payments. And a lot of the improper payments are simply provider billing, right? So if we cut $880 billion, that's not going to help us ferret out bad or illegal provider billing. What that's going to do is it's going to cause the state of Florida to have I think it was I wish, I'm so bad at numbers. I think it's, $4 billion projected loss of federal Medicaid funding per year. So with a $4 billion hole in our Medicaid budget, we're not gonna ferret out fraud and abuse. What we're gonna do is we're gonna cut services to people. We're also gonna rob Peter to pay Paul, right? So maybe we keep some Medicaid services in place, but we need to fill a $4 billion gap in the Medicaid budget, so we might, I don't know, take it from public education. Or other services that we care about, environmental protection, anything, you know, that is meaningful will go to fill that hole in our Medicaid budget. And it's certainly convenient for the federal government to then make it the state's problem. What other good facts do I have about?
Meanwhile, the fraudulent billing continues.
Exactly. Florida's improper payment rate for Medicaid eligibility errors was 3.9%. And it included things that the agency itself was failing to do, like identify missing documents, or just not reviewing a payment request quickly enough. So again, if you take $4 billion away from our Medicaid program, that's going to inhibit our ability to ferret out fraud and abuse, not strengthen it. We do have a healthcare fraud and abuse control program. The recent annual report shows fraud convictions of healthcare providers, shows numerous convictions of healthcare providers. It has 0 reports on fraud by Medicare beneficiaries. Medicaid beneficiaries. Oh my gosh. The Florida Medicaid Fraud Control Unit recovers $18.6 million yearly. So our Medicaid fraud unit is recovering for us $18.6 million a year. And once again, just reiterating, if we cut our Medicaid program by $4 billion, then we are not going to have the staff necessary to recover that $18.6 million. So it's just a lie. I think you guys know that. I'm not saying anything that surprises you, but those are the main arguments that we're going to see. So hopefully those are some talking points to push back on folks as you're advocating in your communities.
You were talking about, you know, the fraud. I used to work for the state I know ACA used to go after all that. I worked in the same building. They cut them back then, so how much more has DeSantis cut them back? Because, you know, with the providers, a lot of it is education and coding properly.
Yes.
But of course, a lot
Yes.
of it, like
Yes.
Scott, they caught him. That's why they got, when
Right.
he became governor, that's when
Yeah,
he got.
talk about healthcare fraud, figuring out healthcare fraud.
Yeah. So I was just wondering how much have they been already cut back, and like, if the doctors are not being paid, will they continue to accept the Medicaid? Because that used to be a problem also.
Absolutely. Have they continued to cut back? Honestly, I haven't looked at ACA's, you know,
Right.
budget over the years. I know that they're requesting a significant amount of money again this year,
Okay.
simply because they're so understaffed.
Yes.
And they have struggled with that for years, as is our Department of Children and Families,
Yeah.
because our legislature just has no will to give these particular agencies the money to actually function well. And then they blame the people who use the programs instead of. To your other point, there is a very complex, I knew this was gonna get brought up. So there's another thing, and he's actually a local guy, and I can't remember his name, but I bet someone here knows his name. He's out of Ponte Vedra, and he works for a very conservative outfit who was behind the 2025 plan. Does anybody know who I'm talking about? I can't remember his name off the top of my head. I'll give it to Carol, because you should look into this guy. But so one of his big targets, and of course he's been the ear of the current administration, is provider taxes in Medicaid. And bear with me, I'm going to try to explain how this works. So what happens is the counties levy a tax on big providers like hospitals. And then the providers pay those taxes, they go up to the state government, who then reimburses the providers and draws down a federal match on that money. Essentially, I don't think that's quite it. It's sophisticated, no doubt, it's sophisticated money laundering, but it's all legal, and most importantly, providers cannot, we have, in fact, Florida has some of the worst provider reimbursement rates in the country. Providers cannot sustain themselves on Medicaid rates.
Right.
So we have to have supplemental payments, and this is one, the provider taxes are one way to supplement the providers willing to participate in Medicaid. So if that goes away, our rural county hospital system goes up in smoke. And actually, this is everybody's most concerned about this, but I hesitate to give this to people as a talking point because I can barely articulate it. And I will say, for example, the Florida Hospital Association is dialed into this particular concern, as all of the hospital associations around the country are. And to get way over my head, apparently it also affects our bond rating, our state bond rating. And so I think it's in our fact sheet. I don't understand. I'm not going to pretend like I understand what a bond rating is for a state, other than it's important that we have a good one. And the loss of these particular taxes will impact the bond rate. Increasing other state project financing costs. So let me go to that footnote. I'll give you that resource in case you're a nerd and want to dig into it. But really, everybody thinks this is going to be one particularly compelling target because no one understands it, and people hear what they're doing, and they immediately think it's something that's wrong and we shouldn't do. But actually, it's tremendously important to keeping providers, particularly in areas where it's harder to access Medicaid services, like rural areas, keep those providers' doors open. My footnotes, I was going to give you the resource. Medicaid cuts hurt state economies. C19. Oh, 19's Ed. Oh dear. Yeah, I think if you Google that. Actually, I will leave these, what I will leave is these footnotes. This isn't completely finalized, but I'll leave the footnotes because there's a lot of great resources in here if you really want to dig into some of the research that's being done right now.
What percentage of Medicaid expenses go to hospitals? Do you know?
I don't know the answer to that.
I would think they'd be lobbying hard,
yeah,
a lot.
I think in terms of these provider taxes, they are. I think the reason I hesitated is we always thought they would be allies in the Medicaid expansion advocacy, and they're not so much. And the reason is because I know it may
complexity of patients, probably.
We have something. There are other pools of uncompensated care dollars that come down from the federal government that have a lot less strings attached to them. Disproportionate share in low-income pools, and hospitals can use them in really flexible ways that they would not be able to use with Medicaid dollars, and they're kind of subject to the rates of Medicaid rates. So they really like those uncompensated care dollars. And what happens with the right federal administration is that when the state expands Medicaid, the federal administration goes, okay, you don't need the uncompensated care dollars anymore because you shouldn't have people who are receiving uncompensated care. And in fact, when after the the Supreme Court decision that found that states should have the option of expanding Medicaid, that it shouldn't be mandatory, at the time, the Obama administration was really turning the screws on the state of Florida and saying we're not gonna continue to provide you your uncompensated care dollars. You have another option, and you need to elect that option. And Florida actually filed suit against CMS, challenging that particular opinion, and then of course, everything got resolved. Weird. So yeah, that's what's happening. I can dish about another CMS issue if you want. Under the Biden administration, CMS issued some regulations about that earlier program I was talking about, Children's Health Insurance Program, and mandated that states not terminate children who were already receiving services through CHIP if they fail to miss a premium payment. Right, if their parent, right, thank you. If their parents fail to miss a premium. I didn't earn my allowance this week. So, and it's called continuous eligibility. We have it in Medicaid too. And Florida was the only state who said, we're not gonna do that. And they sued CMS. The district court judge actually dismissed the complaint for weird lack standing issues. And they went up to the 11th Circuit, but then they moved away from the 11th Circuit because CMS had decided on the waiver and said, sure, oh, I'm sorry. So in the midst of all of this, the Florida legislature decides to expand the income limit for children to qualify for kid care. And Florida submits this request application to CMS for approval. Can we cover kids under kid care 300% of the federal poverty limit, which is 100% more than we currently cover? And CMS said, yes, you can, but you have to provide continuous eligibility to kids in kid care. And so they moved out of the 11th Circuit and back and refiled in the district court after CMS gave them that answer to the waiver. And filed suit again. Now they have better standing because CMS has essentially told them we're not gonna approve your waiver unless you follow this continuous eligibility provision. And you could just tell, like, ACA was just counting, like, that was December, and ACA was just counting the days until the Trump administration came in. And so now they have filed a stay on the case so that CMS can explore whether or not they're gonna approve. I mean, it's great if they approve, right, the expansion up to 300% of the federal poverty limit. It's horrific that they're doing it when every other state is willing to implement continuous eligibility. So do not let the Trump administration or the DeSantis administration tell you they care about kids because they expanded kid care. Because they are doing it in defiance of keeping kids' insurance covered because their parents miss a $15 or $20 premium payment. So that's my rant. We're right at 8, Carol. And I'm pretty much finished with my material.